What does vaping do to the body? Is it bad? And if so, how bad? And how does it compare to regular cigarette smoking? Same, better, or worse? We are going to answer all of those questions. And of course, we are going to bring out some real human lungs to help with this discussion, as well as show you some other organ systems that you probably did not know could be affected by vaping. So let us jump right into this. When it comes to vaping, or bringing any kind of vapor or smoke into the body, it is really important to understand the pathways these substances travel through, because that gives us a clear picture of how they can affect you. So let us take a look at those pathways on the cadaver. This is a sagittal cut through the head, which gives us a view of the upper airways. You can clearly see the nose and the mouth. Now, air can come in through the nose and enter a passageway called the nasal cavity. This septum right here simply divides the nasal cavity into a right and left side. You can also bring air in through the mouth and the oral cavity. But here is the thing, both the nasal cavity and the oral cavity lead to the exact same place. This area right here is called the pharynx. Most of us just call it the throat. As the vapor or air moves down through the pharynx, it hits a fork in the road. The posterior tube, the food tube, or esophagus, is not where this is going. Instead, the air and vapor move into the trachea, which is the anterior tube. And even on a cadaver, you can actually see that the trachea stays open. That makes perfect sense, we are breathing all the time. So the body created small cartilaginous rings to keep the trachea permanently open. The esophagus, on the other hand, can collapse between meals. No problem there. Now, on this particular cadaver we are ending at the trachea, so let me show you a different dissection here of a right lung. Here is the trachea. Air moves down through it, and at the bottom it reaches another fork in the road. From here it can go left into the left lung, or right into the right lung. When the trachea branches like this, we call those branches the bronchi. And as you can see, they continue to branch further and further into the lung tissue, becoming different types of bronchi along the way. As the bronchi keep branching and getting smaller, we change the name to bronchioles. And eventually those bronchioles lead into structures called alveolar sacs, which are made up of individual units called alveoli. Now, that is your anatomy lesson for how air travels in. But the most important part of all of this is the alveoli, because these are the thinnest tissues in the entire lung. Only 1 cell thick. And that is critical, because this is exactly where oxygen and carbon dioxide are exchanged with the bloodstream. The alveoli and the bronchioles also happen to be the structures most affected when we talk about vaping. So what exactly is vaping? Vaping started with e-cigarettes, which were originally designed to mimic regular cigarettes. However, the technology has changed dramatically over the last several years. These devices are now typically larger, rechargeable, and contain a cartridge filled with a liquid. That liquid is heated by passing through something called an atomizer, which vaporizes it, and that vapor is what gets inhaled. Hence the name vaping. But is bringing that vapor into the human body actually harmful? It definitely can be. Over the past several years, hospitals have seen a significant increase in patients presenting with acute lung injury directly linked to vaping. This condition now has an official name, e-cigarette or vaping product use associated lung injury. Or EVALI, which is what we will call it for the rest of this video. These patients were coming in with symptoms that looked almost identical to pneumonia. But here is what made it unusual: when clinicians ran their tests, they could find no viral cause. No bacterial cause. Nothing infectious. What these patients did have in common was that they had all recently been vaping. So the working theory became that something inside that cartridge, something being vaporized and inhaled, was causing damage to the lungs. Before we get into what that substance might be, let us talk about what these patients were actually experiencing. Many came in with fever, chills, and a general feeling of being unwell. They also presented with cough, shortness of breath, chest pain, and in some cases something called hemoptysis, which is the medical term for coughing up blood. All of that makes sense when you consider that something inhaled could directly injure lung tissue. But here is the part that surprises most people. Up to 80% of patients with EVALI also had gastrointestinal symptoms. Nausea, vomiting, diarrhea, and generalized abdominal pain. So this was not just affecting the lungs, it was hitting the GI tract as well. Now the big question. What is actually inside these cartridges that could be causing all of this? The challenge here is that vaping is not a tightly regulated industry. So the ingredients one manufacturer uses may be completely different from what another manufacturer puts in their product. However, researchers have identified a number of common ingredients found across many of these products. Some of those include nicotine, which we already know is addictive and causes substance dependence. There is also propylene glycol and glycerol, which are known as humectants, substances that help keep the liquid inside the cartridge moist. You will also find things like THC, CBD oils, and vitamin E acetate. On top of that, these products can contain over 7,000 different flavoring compounds. And in some cases, trace amounts of metals have been detected, things like tin, nickel, chromium, manganese, and even arsenic. Now out of all of those ingredients, are some more problematic than others? Did researchers find any specific links to certain substances? Yes. They did. When clinicians were evaluating patients with EVALI, they were observing rapid heart rate, rapid breathing, and low oxygen saturation. Chest X-rays and CT scans were showing infiltrates and opacities in the lungs, classic signs that look exactly like pneumonia. But cultures came back negative for bacteria. Viral panels came back negative. And that left clinicians searching for answers. So in many of these cases, they performed a procedure called a bronchoalveolar lavage. This involves inserting a fiber optic scope down through the trachea and into the deeper airways. Once the scope reaches the bronchioles and alveoli, saline, essentially a saltwater solution, is injected directly into those terminal airways. Then that fluid is suctioned back out and analyzed. What they found was striking. The majority of EVALI patients tested through bronchoalveolar lavage had two things in common: vitamin E acetate and THC. Now, since when is vitamin E harmful? Under normal circumstances, it is not. When you apply it to your skin in a lotion or cream, it is perfectly fine. When you ingest it and it travels down the esophagus, the body processes it through the digestive system without issue. But that is a completely different pathway than inhaling it. When vitamin E acetate is vaporized and inhaled, it travels down the trachea, into the bronchi, through the bronchioles, and directly into the alveoli, the thinnest, most delicate tissue in the entire lung. The current theory is that this oily, thickening substance coats the lining of those airways and triggers an inflammatory response. Whether it is also interacting with cells in some other way, we do not yet know the exact mechanism. More research is still needed. But the link is strong enough that the CDC has made a clear recommendation: vaping companies should not use vitamin E acetate in their products. And consumers should avoid any product that contains it. The CDC has also recommended avoiding products that contain THC, again, because of how consistently it was found in the bronchoalveolar lavage of EVALI patients. So how do patients with EVALI actually fare? Up until February of 2020, the CDC tracked data on 2,807 people hospitalized with this condition. Of those 2,807 patients, 68 died. That works out to approximately 2.4%. To be clear, that is not 2.4% of everyone who vapes. That is 2.4% of people who develop EVALI. The majority of people who get EVALI do recover. During treatment, many patients receive antibiotics, not because there is a confirmed infection, but because the presentation is so similar to pneumonia that clinicians treat it as a precaution until an infectious cause can be fully ruled out. Once that is ruled out, antibiotics are no longer useful. At that point, treatment becomes largely supportive. Some clinicians have seen meaningful improvement in their patients by using anti-inflammatory steroids, which can help calm down the inflammation happening in the lung tissue. Most hospitalized patients will also receive supplemental oxygen. How much depends on the severity of the case. In more severe situations, mechanical ventilation may become necessary. The encouraging news is that the majority of patients see noticeable improvement in their symptoms within about 2 weeks. There may be some residual effects that take a few additional weeks to fully resolve, but within that 2 to 4 week window, most people report starting to feel like themselves again. As for long-term effects, we genuinely do not know yet. This is still a relatively new phenomenon and the research is ongoing. Now, the question everyone wants answered. How does vaping compare to regular cigarette smoking? The general consensus within the medical community is that if you had to choose between the two, smoking is worse than vaping. That said, we have decades of research on the long-term effects of cigarette smoking. With vaping, we simply do not have that yet. It is too new, and we are still working out the exact mechanisms of how substances like vitamin E acetate contribute to a valley. To put it in a clinical context, if a patient came in wanting to quit smoking and asked whether they could switch to vaping, the ideal recommendation would be to do neither. There are medications with well-established safety and efficacy profiles that can help manage nicotine dependence in a much better understood way. But if a patient refused medication and insisted on choosing between the two, a clinician would say, stop smoking and switch to vaping. And importantly, the CDC specifically recommends not mixing the two. If you are going to use vaping as a step toward quitting, you have to fully eliminate the cigarette smoke. The goal is smoking cessation, and vaping, while not harmless, does appear to cause less damage to lung tissue than cigarette smoke. Now, what about people who have never smoked and have no intention of starting, but are currently vaping or thinking about it? The recommendation remains the same. Avoid products containing vitamin E acetate. Avoid products containing THC unless obtained through a qualified medical professional or through channels that are legal in your area. And ideally, in a perfect world, do not inhale any foreign substance into your lung tissue at all. There is also a growing concern about the surge in vaping among younger populations, junior high students, high school students, people in their early 20s. Beyond the direct harm to developing lungs, there is now enough data to show that people who vape are significantly more likely to eventually try cigarette smoking. And cigarette smoking, as we have just covered, is known to be even more harmful. We only get 2 of these organs. These extraordinary, intricate lungs that keep us breathing every second of every day. They deserve to be taken care of. If you must vape, avoid the vitamin E acetate. And get your THC from a legitimate, legal, and qualified source. Thanks for watching. Blow up the comments section below and we will see you in the next video.